Good afternoon, everyone. This is Caradina Sale with the McSilver Institute, along with the Community Technical Assistance Center of New York State. Thank you so much for joining us for our second webinar today. We're talking about assessment with children and families. This is the second webinar of our two-part series, which we're talking about an overview, best practices, and application. Last week, we talked about the overview, where Dr. Plummer presented an overview of the assessment, and this week she'll be sharing information on best practices and application. As a reminder, we know how important assessment is as a tool that allows you as providers to focus on people, their symptoms, their presenting problems, their relationships, barriers from other people or systems, past experiences with mental health services, and their overall environment. We know that client system assessments are an essential component that informs treatment. I really think you'll enjoy today's presentation. There is going to be a short video because we're having a little practice component. So just make sure that your speakers and your volumes are turned up for that. And I also just wanted to remind you for optimal viewing, you can go into the top corner and click view, top right corner, click view. And if you click side-by-side speaker, that's probably the best way to view the webinar, okay? All right, without further ado, Dr. Plummer, I'll pass it on to you.
Yes. Good afternoon, everyone. I am so excited to be here with you all again this week. So, of course, last week, like Kara mentioned, we did an overview of assessments and we talked about some of the important information that we need in order to have good quality assessment experiences and why we assess. We'll do a little bit of review today as well for those of you all who may have missed last week, or for people who just want a refresher. And then we'll get into some of those best practices. So again, my name is Dr. Linnell Plummer. I am the CEO of Onyx Therapy Group, which is a mental health company headquartered in Washington, D.C. However, we have offices, 9 offices in 4 states, including Maryland, Pennsylvania, and Minnesota. So super excited to do this work. As a refresher, my career started off working with children and families, primarily in schools and in the community. And so I have a lot of experience in different ways that we assess our clients, that are children and their families as well. And I think we're going to review some of the questions that you all asked at the end, just so I can make sure everyone has those answers. But I want to also emphasize that when my career started, I was working in a bilingual environment, so very much familiar with different cultural pieces as it relates to language, as it relates to countries of birth, as it relates to transitions and how one found themselves here in the United States. Of course, some by choice and some not by choice, but how all of that is a cultural element that affects how they interact with us as mental health people, but also how they interact with assessments. I am very much an extrovert, so please use that chat, ask all the questions, give all the feedback so that we can engage with each other. In our pre-COVID days, I would 100% be in person with folks and be able to answer questions that way as well. But let's use this to the best of our abilities. So again, thank you for joining me this afternoon, and let's get started on assessment part 2, the application of best practices. So our agenda today, we're going to do our welcome, and then we're going to review why we're here. So let's first start off and tell me, how was your week? Did you watch the TED Talk? That was one of the homework assignments. And what are your thoughts? And then the third question is, how did you assess yourself this week using those 5 senses? Remember, we talked about how we use assessment to observe and sounds and things that we hear and things we don't hear. So let's light up that chat and tell me, what were your thoughts on that TED Talk? How was your week? And how did you assess yourself this week using your 5 senses? Yes, the TED Talk was enlightening and powerful. Love to see young people opening up and talking about self-care, which is an intervention of itself, right? And sometimes it's a SMART goal to have young people intentionally engage in self-care. when they start early in that practice, then it becomes habit for them that they're able to sustain over time. I love that you all are introducing yourselves. So, in thinking about how we assess ourselves, I have assessed myself through my water intake. Simple way, right? Me and my friends have been talking about different ways that we can determine how we're having enough water. So, I assessed my water intake by seeing how my fingers and my toes felt at each evening as I was going to bed. Did they feel a little bit swollen? Did they feel nice and fluid? So, a way that we assess in a very common way. And of course, I talked about last week assessing my plants and their health, looking at them, touching their dirt, looking at the light, how much light is coming in. Oh, yes, people getting together for Mother's Day. Absolutely. And everyone being vaccinated. I appreciate you all. Continue to use the chat, and answer these questions. Again, in review, why are we here? Well, we're here to loosen up the concept around assessments. Remember, from last week, I talked very explicitly around assessments in the most simplistic way of saying it is only used to gather information so that we can make a decision. We gather information to make a decision. I was gathering information around my water intake by using my five senses and checking on how I felt and the fluidity in my limbs to make a decision. That decision was, do I increase my water intake? Do I decrease my water intake? So we gather information to make a decision. You find that you're assessing quite frequently through the day. We just don't necessarily call it that. So I want to loosen up that concept again, that we assess, meaning that we gather information so that we can make a decision. We're also here to answer some of those key questions from last week. That's the good old professor in me who wants to make sure everybody has their questions answered so they feel confident and competent as they move on from this training, and then to learn those best practices. So some questions from last week. And I took these questions very explicitly from the chat. So I'm curious about your thoughts on ODD, oppositional defiant disorder, as a diagnosis, and whether it should be given, especially when stemming from situational factors. My answer is, I believe that all factors should be assessed before we give a diagnosis of oppositional defiant disorder. I do believe that it is a valid diagnosis and that the interventions are very unique and specific, specifically including a lot of reverse psychology and a ton of rapport building. I have had many clients who have had oppositional defiant disorder, and within about a year's time, we were really able to reverse that, but it took a lot of intentional work. It also included me assessing their environment. It included me doing a lot of observation. It included me listening to what they were saying and what they were not saying, as well as what their parents were saying and what their parents were not saying. So even today, I am in touch with many of those former clients because they were students. And those clients that had oppositional defiant disorder are doing extremely well in life right now. One of them is in college. Can you believe it? In college already. And doing really well. So I do believe that it is a fair and valid diagnosis. However, I do think that all factors need to be assessed before placing that diagnosis alongside a client. Question, helping clients receive that information, but not identifying with the results or diagnosis. So how do we help clients receive information from our assessments, and they're not necessarily identifying with the results or the diagnosis? So for this particular question, I think that it's extremely important that we use techniques when delivering information, delivering assessment results, and wanting to make sure that they take responsibility for their results as well, that we use techniques related to courageous conversations. So there are tons of books and articles, TED Talks, and different trainings around how to use courageous conversations. In addition, there are techniques related to the 6-step communication process. In quick review, that 6-step communication process is person 1 speaks, person 2 person two summarizes. So they repeat what they hear us saying, and then person one will go back and clarify. So if I'm delivering information to a client, I will give the information, and then I will ask them, what did you hear me say? And then they summarize back to me what they heard me say. And if they got it correct, exactly how I needed them to get it, then I say yes. And then they are able to respond. Me saying yes is step 3. Them being able to respond with their questions is step 4. If they did not summarize it properly in step 2, then I get to clarify it in step 3. And then they respond in step 4. I summarize and they confirm. So I could write that out for you guys in the chat later, or you guys can email me about it if you have any questions. When delivering information, it's also important to use the sandwich approach. So we're starting off with really, really great information, lots of strengths, lots of pros, things that are working really well, the strengths of that particular assessment process, so their vulnerability or their ability to give information, or their patience during the process. And then we go into the meat of the assessment results, and sometimes that may be some of the cons or some of the things that need to be worked on, some of the growth opportunities. And then we end with something positive as well. And what we're ending with is maybe, thank you for your patience during this process, through this conversation. Thank you for, receiving this information well. I do truly believe that we can make progress in terms of these goals. And so it's a set positive, and then the difficulty piece, and then the positive again is what we call the sandwich approach. What if your agency is more old school and westernized? Well, that happens often, right? That is part of sometimes being here in the United States. And I think that it's important to just chisel away slowly. So, dropping information to your leaders about slides that for presentations that you've attended, finding articles and sending it to them, asking if you can attend particular trainings and reporting it back at staff meetings, things like that. So slowly chiseling away at those old school practices. The other thing that I find that most old school or westernized agencies do well with is the collection of data. So if you are working with your client slightly different, but with permission of the organization, and you collect a lot of data and you're making a lot of progress, then typically they want to know more, and they'll give you a little bit more freedom because they're seeing that progress is still being made with interventions and techniques that were not necessarily aligned with the organization. So again, this slow chisel away. What about if how do we get assessments in Spanish, especially for intellectual disabilities? Well, that's an entire presentation by itself. Anytime we're making assessment changes based off of language. So what I would like you all to do, anyone who has this question, is to email me. I have my email at the end of this slide, but in the last slides from last week as well. But email me and I can work with you to find the resources and jump on a call or a video with you and talk to you through that particular process. I don't mind at all spending some time with you all after this after these trainings over the next couple of weeks. So do I have recommendations for resources to help make our assessment, our mindset more culturally sensitive? One of the major pieces about assessments is that in order to have validity and reliability, we have to stay consistent with how the assessment was designed. So we're looking at the fidelity and the structure of the assessment. However, it is culturally appropriate to reframe some of the wording. So if there's a word in assessment that does not translate well culturally, not just in language, but culturally, then what you want to do is consult with someone from that culture to see if they could give you some pointers. What I do in my practice is I will select an assessment, and if I know, say I'm working with somebody who is Asian descent, maybe Korean, I'll run it by someone who I know is familiar with the Korean culture and see if there's any words or language that needs to be reframed so that it makes sense for the client. So it's really a matter of making sure you have people in your community, in your own village that are culturally diverse so that you can ask them to look over the assessment to make sure that it's culturally appropriate for your audience. The next question is can you create your own assessment and what should you consider? Yes, you can create your own assessment. If you have not been trained in factor analysis, which is the formal way of making assessments, if you have not been trained in factor analysis, the assessment will be considered informal, which is perfectly fine because remember, I talked about the different types of assessments, including formal and informal assessments. So you can absolutely create your own assessments based off of the information that you want to gather from the client so that you can make a decision along with the client that's appropriate for them. What I will say is that when you are creating your own assessment, even if it is informal, you need to take some time to analyze the data and consider what you actually want to report. When we're doing formal assessments, the manuals, our books will tell us what needs to be reported. But when you are making your own, you have to decide what is most appropriate to share with the client and what is the data that you are analyzing. Feel free to continue to use the chat and ask any questions you have. So those were the major questions that were asked last week. Some of the other questions, there were maybe two more. They are going to be addressed specifically here in this training, like best practices, et cetera. So I didn't put information, I didn't specifically answer those because I knew that they would be answered throughout this training. If I missed your question from last week, please put it in the chat and I'll make sure to have time towards the end to answer that for you. So in review from last week, the purpose of assessments is to collect information to make a decision. So we're collecting information through our senses. We're collecting information based on what we see, what we see, what we hear, and that means what was said and what was not said. What we feel in terms of our intuition, because our intuition is a guide. We are professionals in all settings with our clients, but we are also humans that have a human experience, a human essence, and we have an intuition. Our intuition is not to be pushed aside for formality of technique. It is to be interwoven into the process. That is an important piece because when our theories and many of our assessments were formed, they were formed by people who did not value intuition. I know this because I studied it extensively. I went to Vienna, Austria, and did some work there to study different elements of culture and where culture lapses occurred as psychology was forming and as some of these assessments were starting to be rooted as well. They didn't value intuition as much as they valued formula because many of them were medical doctors and medical scientists as opposed to social sciences. So intuition wasn't integrated into the process. However, we understand that as culturally based people or humans in general, that intuition is a major part of our assessment process. What are you feeling in this moment? Are you feeling that something is missing? Are you feeling that there's a different question that needs to be asked? Are you feeling that maybe it's time for the assessment period to end because the clients are getting tired? So we're assessing through what we are observing. We're assessing based off of what was said and what was not said. We are assessing based off of our intuition, and then we are assessing based off of our documentation, what we read. So that is what I put documentation in the forms at the bottom because oftentimes we make that the forefront and we forget to assess on observation, on hearing, and on feeling. So make sure that you are, again, paying attention to what you're seeing, what you're hearing, and what you're feeling, along with the technical forms and documentation. So we collect all of this information so that we can make a decision. That's where we're creating our SMART plans, our treatment plans. We're making our SMART goals with a very specific emphasis on measurability and time orientation. We're choosing interventions and we're forecasting success and progress. So again, the types of assessments in review, there's informal assessments such as conversation, anecdotal notes, filling cards, worksheets. So these are ways that we are assessing information without actual documentation. This is where we are, again, gathering information. We're gathering information when we're talking with our clients and when we're jotting down a few notes and we're analyzing them later. When we're playing cards and filling cards and we get to understand what kind of feelings they generally have. And we're doing it through assessment, or excuse me, worksheets. For semi-formal, we assess through questionnaires, through interviews, and through the mental status exam. Those are considered semi-formal because they are usually a document that's attached to them, a document that has all the questions on there, or a document that has the interview guide, as well as the very specific things we're reviewing when it comes to mental status exam. They are not as formal because they have not gone through a validity and reliability check, but they are semi-formal because there is documentation that needs to be completed and filled out for them. And then, of course, we have all of our formal assessments, which many of us are familiar with. I did not include them as review on this particular presentation because they are in the slides from last week. So please review those slides to see a series of formal assessments that I researched and have used that I wanted to share with you all. So let's go into some new information. We've done our review. And again, if you have any questions, make sure you are sending a message to me through the chat. But let's go into some new information. So best practices. When we are doing assessments, let me rewind. There have been many times when I have talked to mental health practitioners and they tell me, well, I believe this client has ADHD, so I am going to use this assessment and this assessment. And I have to pause them and remind them that what they see in that short amount of time may not necessarily be what is a full case of what's going on. Rather, it is us jumping to a conclusion. Oh, this child is hyperactive, it must be ADHD, as opposed to a trauma response, lead poisoning, having a bad day, a messed up diet, whatever the case may be. And if we immediately assess based off of what we see in this small snapshot, then we are likely to miss any other thing that may be going on in the client's life. So it is better as best practice to start with a broad band assessment. Broad band assessments are single assessments that assess a lot of different factors. So they are assessing for environmental changes. They are assessing for depression. They are assessing for anxiety, for ADHD, for conduct disorder, for a family systems dysfunction. They are assessing for a number of different factors. They're assessing for health issues. They are broadband assessments. And it is best practice to use a broadband assessment. Look at that data because it is going to highlight areas. It's going to ding ding in areas of concern. So it may say the child has concerns with ADHD and depression. And then you do a diagnostic assessment. And those are the assessments that are specifically for the diagnosis, specifically for depression, specifically for ADHD. But again, we start with the broadband assessments to ensure that we don't miss something, that we capture everything that the client is going through. And then we look at the results from the broadband to determine what kind of a specific diagnostic assessment needs to be done. Let me check the chat to see if there's any questions because we often don't talk about broadband assessments, but I wanted to bring that to the forefront as a best practice. Okay, yes. Some folks want to see some slides from last week. They were good. They were good. Okay. So again, if you have any questions, let me know. But again, a broadband assessment is assessing everything. And then we go to the specific diagnostic assessment based on what the broadband results are. After we have the diagnostic assessment, we then go through an intake or case conceptualization process where we're gathering a little bit more information. You may say, Dr. Plummer, why are we doing intake after broadband and after diagnostic? And my answer to that is that intake is going to give you more information, but you can't take information just from the intake and go jump to a diagnostic assessment, because many clients are not going to report everything that's happening in their life in that first intake, primarily because we're still strangers to them. And if we're thinking about it from a cultural perspective, many cultural minorities have been taught to not give all of their information to strangers. It has not worked out for them historically in the past. So they're a little bit more conservative, a little bit more hesitant in giving the information. However, if you start off with the broadband assessment, it's not as personal as having to talk to someone and share all of their personal business, right? So we go broadband, and then we go diagnostic assessment, and then we go intake. Then we go into the actual diagnosis. So the diagnostic assessment is not where we get the diagnosis. We get it fourth in line as best practice. Broadband, diagnostic assessment based off of the results from the broadband. Then intake and case conceptualization, because we're still gathering a lot of information to make a decision. And then we go into the diagnosis, and then we create the treatment plan, and then we create the interventions. I see a little movement in the chat, so let me check it really quickly. Okay, perfect. Yes, exactly. Yes, I imagine that has to do very much well with the fact that many of our clients are not always willing to talk to us and share their information right away. Okay, thank you for the participant who talked about what is happening at your clinic. This may be where you get to chisel away again at some of the approaches that are being used. It is not unfamiliar for many agencies or organizations to not use broadband because they take up an additional step in the process, which delays the time to get the diagnosis, which may delay reimbursement from clients or insurance companies. So I understand why they don't do it. However, as best practices for you all, it is important to try to weave that in, try to weave in some broadband assessments. So I included a couple here. When we're working with children, we're looking at the BASC, we're looking at the Aschenbach Child Behavior Checklist, and Ohio scales is something that is extremely easy to navigate as well. I put a couple of these in the resources on the resource slide so that you can access it. So again, we go very broad. All the different potential diagnoses or concerns are being evaluated, and then we go into a diagnostic assessment. So then here for a diagnostic assessment, we have the WISE functional impairment rating scale, which is assessing one specific diagnosis. Again, we get that result, we do the intake, we do the case conceptualization, and then we go into actually setting the diagnosis and actually creating the treatment plan and the subsequent interventions that align with it as well. So best practices, as we consider what I just mentioned, and what my research and my life experiences have shown, here are a couple best practices that we need to consider. Consider that most assessments were created by white male researchers, not culturally diverse practitioners, meaning that these white men were taking their own experiences and deciding what they thought it was important to assess, what kind of information should be gathered, what kind of questions should be asked. But they're writing the questions and they're going through their factor analysis, the way we make assessments. They go through that process based off of their own cultural lens, not always considering the cultural lens of the client or the experience of the practitioner who will be doing the assessment. I wanted to highlight here that I said that they are created by researchers, not practitioners. We are practitioners. We are in front of our clients every day. We are understanding what's happening in their lives. We're using our five senses to process information with them and to assess with them. So when we are considering that most assessments were created by people who are different than us or who are different than our clients, we may sometimes need to use 2 to 4 different assessments to really get information from the clients. One assessment may miss some things, even the broadband assessments, which is why on the previous slide, I mentioned using 2 broadband assessments, because the more assessments you can use, the more diverse you can make the process for the client, and the more you can reframe some of the questions that are asked as well. So consider that you may need to use 2 to 4 different assessments to really assess the client, because the actual formal assessments were not created by people like us or people like our clients that we're working with. We also have to consider that assessments are used to gather information and to make a decision. And this should be done through conversation as opposed to interrogation. Sometimes we get our assessments in front of us and we just start asking the questions. So what about, and what are your thoughts, and such and such and such, as opposed to making conversation with the client, looking at the client, smiling with the client, nodding our head with the client, acknowledging what's actually happening in the session. This is a lot of questions. At any point, we need to slow down, let me know. Leaning in when we're talking to the client, right? Leaning back out when we have a little bit of separation that needs to be made. So making sure that when we're doing the assessments, it comes in the form of a conversation. Imagine you on the receiving end. Would you want someone just asking you 50 questions back to back? Or would you rather them say, I understand. Thank you for sharing. Oh, that's interesting. What a good point. Oh, this sounds like, this makes a connection with, oh, this reminds me of, and then they're connecting with you, because to that third point, rapport matters more than anything else, especially when we're thinking about culturally diverse clients. Like I mentioned before, most clients don't want to tell their business to a stranger. To us, we are not a stranger. We think we're the coolest, nicest, most relaxed practitioners around. But to them, we are a stranger. And many of them have had experiences, like I mentioned before, that when they share information with a stranger, it doesn't always work out in their best interest. It may mean that there's different cases that are used against them, that decisions are being made that are not aligned with their goals or their values or what they wanted for themselves. So many people have learned to be hesitant in talking to strangers. You guys remember when we were young, stranger danger. Sometimes strangers equal danger. So they may not talk to a person that they don't feel comfortable with. So as a best practice, focus on building that rapport and doing that assessment as a conversation and doing it over a period of time. In Onyx, we don't use our clipboards when we're gathering information. Generally, we know the questions because we've been familiar with them, and we just ask them as they flow. So tell me a little bit about your trauma history. Have you experienced community violence? What does that look like? You have? Okay, tell me a little bit more about that. How did that shift how you interacted with your community? How did that shift how you interacted with those that were around you? That does make sense. Yeah, you're right. You're right. And that is how our assessments kind of go. And then we are collecting that information and we're writing it down somewhere else or jotting it on the side. We're also considering as best practices, again, the human experience, like I just kind of demonstrated for you. Thank you for sharing, validating, using tones and smiles and head nods to assure them that it is safe to give us the information. Another best practice consideration is the time of day. So some clients, let me list it out. There's many factors that will affect what a client says and does during the assessment period. For people who are morning people, they may share the most information in the morning, and by the afternoon, they're tired. The time of week, the day of week, what day is it? Is it Friday and they're exhausted? Is it Monday and they have a fresh start? And that's for people who work a traditional Monday through Friday schedule. Some people work over the weekends, and that changes their exhaustion and what they can recall in terms of the information that we need to gather for the assessment. We need to assess or consider factors like, have there been any other changes in a child's or a family's life in the last month? Has a relative passed away? Has a relative come new to the country? Has a relative left the country? Was there a loss of employment that caused additional stress in the family? What are the additional factors that are in place? What is their history with service providers and agencies? Have they been burned before by agencies and by providers and subsequently don't want to share a lot of information? Are they taking any medication that has side effects that makes them drowsy or forgetful? Or do they have seasonal allergies, which is something that we forget? You guys see me struggling a little bit to breathe during this presentation. Seasonal allergies can make people tired. Seasonal allergies can make people not want to engage in anything else going on. So considering all those factors when we are gathering the information and determining how we can make adjustments so that the client is in the best place possible, the best mental, physical situation, so that he and she and their family can give information. And again, like I mentioned before, use your intuition, not always your fear or emotion, but intuition as your guide. I see some questions in the chat. Will there be a certificate of participation sent out? That is a question for Kara, please. Kara.
No, but if you need evidence that you participated in this, please email us and we'll get that to you.
Yes, thank you, Kara. Thank you. What happens regarding financial concerns due to paying for the assessments that can be cost prohibitive? There are times when, so some of these assessments, like the broadband assessments, the agency or the practice will buy it the first time and use it with the client multiple times over. The clinicians just have to know how to evaluate and read the assessments. The cost for the client may be dependent on their insurance or whatever practice is put in place for the agency. So that's a difficult question to answer because each agency has its own practice when it comes to assessments. For Onyx, we bill the insurance company. If they have insurance, we bill the insurance company for the assessment. There are times when the insurance company may not pay back for the assessment. And as the CEO, I have made a decision that that is fine because my clinicians actually need the information from the assessments to build out good treatment plans and to choose good interventions. So it is in our best interest as the clinicians to have the assessment results. And sometimes that means that we take a financial loss. However, I've made the decision, again, for Onyx, and many CEOs and company leads and executive directors and clinical directors will make their own decisions. But again, for me, we operate in the best practices possible, and we need the information from the assessments so that we can make the best treatment plan, so that we could choose the best intervention, so that we can have the best results for our clients. I hope that answered the question. If not, please clarify the question in the chat as well. So in thinking about last week, some specific best practices specific to the assessment. So once you choose your assessment, your broadband assessment, we're talking formal assessment. Once you choose your formal broadband assessment, and then from those results, choose your formal diagnostic assessment, you are going to take some time to consider and understand the assessment that you're using. What is the full purpose and what was it designed for? Is it really designed to assess the information you're seeking? Some assessments have names in them that are not necessarily assessing that particular issue. So the BASC, for instance, says it's assessing behavior, but it also assesses self-esteem. It also assesses cognition. It also assesses for depression and anxiety. So it's not just for the specific behavior. So some of the assessment titles can be misleading. So make sure you read the assessment so you can check to see if it's what you need. Check to see if the assessment is in another language. Sometimes the assessments are, we have more access to them because we're in the United States and our official language is English. However, the same assessment can be used in Switzerland or in China or in Brazil or in Colombia or Panama. And so the assessment may have already been translated and we just don't have as much ease to access to it because we're here in the US. But many times these assessments are also used in other countries, and so they've already been translated. We just need to get access to them, of which I can help you all with. Make sure for each specific assessment that you're using, you reframe the statements to be culturally responsive. Culturally responsive for age, culturally responsive for ethnicity, culturally responsive for how they just interact with the world. So some assessments we have to change the wording so that it makes sense to children. Sometimes we have to change the word so that it aligns with an experience of an LGBTQ family. So just be willing to sit with the assessment and reframe it. Again, consult with people who are part of that community or that culture so that you can be most appropriate and effective. Give some of the questions ahead of time. Sometimes clients get nervous about the assessment period and they shut down. Give them a couple sample questions ahead of time, just so that they can see what those assessment questions are, that it's not as scary or intimidating or negatively impactful that sometimes they have created in their mind. So go ahead and give some questions ahead of time. And then do a check for understanding. Make sure that the clients are understanding the questions before they answer the question, because sometimes they may just answer the question based off of what they think the question is saying and meaning, as opposed to what it actually means. So a check for understanding, like, how does this question sound for you? Kind of makes sense? Yeah? Okay, go ahead, tell me the answer, right? Tell me what you're thinking, as opposed to, do you understand me? Because sometimes that's condescending. So I like the approach of, how does this question sound? Sound okay? Okay, what are you thinking? Okay, all right, tell me your answer. All right, I'm ready. Something like that. So from last week, I asked a question for you all to use in the chat. What is the most challenging piece when you are conducting assessments with caregivers and children? And the answer that showed up the most was evaluating the results. So I wanted to give a little bit of feedback on the best practices for evaluating reports. So the major piece of evaluating results is analyzing the information. In the second bullet here, I put analyzing in terms of inspecting or scrutinizing or looking at details. So how do you go deep into the information that has been given to you? So we gather this information so that we can make a decision. But that dot in between is the analysis period. So how do we analyze the data? One, we can use the assessments tool that has an evaluation structure. Many assessments tell us how to evaluate the data, so we can use that. But what I like to do as a best practice for Onyx is to lay out all the assessments in front of me, take notes on the assessments or on a sheet of paper, and start looking for patterns, looking for what is consistent, but looking for things that seem a little inconsistent. That's where I use my intuition. So I'm laying out all these assessments. I see this in this assessment. I see this showed up in this assessment. Oh, this showed up in the intake. Oh, this showed up in this document. Oh, I wonder why it didn't show up here. This seems to be an inconsistency. So I'm taking a lot of notes. I'm cross-examining that information, and then I'm looking for strengths and weaknesses. So what are some of the strengths of the client and what are some of the weaknesses of the client? I may look at their past evaluations if I have the opportunity, but I may also be looking at their strengths overall and their weaknesses overall. We also want to consider the qualitative information and the quantitative information. So that qualitative information may have come in an informal. Qualitative is related to relationships. So it may have come in a conversation we had with a client, some of those anecdotal notes, some of the feeling cards that we may have used, some of the things that we observed, and some of the things that we heard. That is the qualitative information. The quantitative is the actual numbers from formalized assessments. And if possible, you want to give yourself enough time to evaluate the assessments before you make the results. So you want to take this time to analyze it by laying it out, writing these notes, looking at patterns, looking at inconsistencies. And sometimes that can take up to a day to do. I recognize that there are times when we don't have as much time. And so subsequently, we kind of rush through the process. What I'm asking you to do is to take as much time as you possibly can. I'm not trying to get you in trouble with your agencies, but again, we are looking at best practices here. And in order to really pay attention to some of these patterns and inconsistencies, we need a little bit more time with them. I see we have a question here. I've observed individuals not explicitly asking certain questions on the assessment and recording a response based on what I believe is the assessor's intuition. By intuition, I'm meaning when you are assessing the client, asking an additional question if you don't get answers, right? Like, so they may answer the question and you're like, oh, okay. And it makes me wonder about, and then you ask an additional question, right? Which means that you're going off script of the formal assessment a little bit. What you are describing in this particular situation is unethical. What we are writing down as results for assessments should be what the client is saying and not removing information because of that. And we don't use our informal assessments. We're not necessarily, again, we're not removing information because that is inappropriate and unethical, yes. So we're using our intuition to fill in some of the blanks. If we see some inconsistencies or we see some blanks, we just, and we feel it, right? We all have intuition. We feel something and we feel the intuition, then we go ahead and ask the additional question as well. So let's practice. We have just a few minutes. I'm going to show you guys a short video. I want you to watch the video. In fact, if you can, and you have your phones with you, take a quick screenshot of this particular slide. And as you're watching the video, I want you to assess using your senses. What did you observe? What was said? What was not said? What did you feel? What showed up for you? And then think about what kind of questions would you ask to get to know the client? Some affirming statements, as well as some statements out of curiosity. And then what broadband kind of assessment areas would you want to assess for with this family? What broad assessments would you want to assess for? So see, these don't have much to do with specific diagnosis because I'm asking broadband. So we're assessing for a lot of information so that we could then narrow it down to diagnosis. So take a quick screenshot and watch the video with these questions in mind. Oh, let me see, hold on here. Give me 1 second. Let's see. I practiced this ahead of time. I promise you I did.
She did.
Okay. Let me try it. Hold on, let's try to share it one more time. Kara, can you all see it?
I see it.
Okay, perfect.
So he's
Can you
taken
all
from the
hear it?
mother, he's taken from his grandparents.
Yes.
So you've only taken from the family?
Yeah. Sorry, Kara, can you hear it as well?
Yes, it's a little low, but we can hear it.
Okay,
Chat in if you can hear it.
okay. I have all the settings. I hope everyone can hear it well.
Okay.
A store and I got caught.
Oh, store. That's what I was looking for. Something outside the. Okay. What did you take at the store?
Candy.
Mm-hmm.
I got caught. And I regretted that day for the rest of my life.
That sounds like a good line for a movie, Earl. Okay. What else are you in here for?
That's it.
That's it? No other problems? Rosalind? You don't have any other worries about Earl other than he took some candy and some money?
Well, sometime after he is caught and the evidence is there, he'll sometime try to cover it up, which I guess is a natural thing for a person to do, maybe, you know, and that's irritating. It's very irritating, you know, if you goods there and, you know, hey, you did it, and you're saying, I didn't do it, they did it, and it's nobody over there. If you get my point, then
I get your point.
That's irritating. It's irritating to me.
He has a pretty good image of you. Let me ask you this other question, though, following from all the other questions. How much talking do you two do together about how to handle this guy?
Not much, because when I'm around, they, you know, I don't have to,
Right.
you know, do a lot of things as far as a punishment to him. Right now is the ball's in her hand, and I expect her when she can't handle him, you know, to let me know. I'll bring him out on my job.
How much? That's really part of my question. Is how much, Rosalind, do you let him know you need his help with Earl?
Okay. Oh my. Excuse me. So now that we've watched that very short clip, I want you to go back to our slides and answer those questions that we had here. So use the chat. I should see the chat lighting up. What are some things you observed? What are some things that was said, what was not said? Tell me what you felt, what your intuition was. And you can answer all of these questions or any of these questions. But let's light up that chat. What questions would you ask the client? And what kind of information would you want to assess for? I see those answers coming in. Yes. Yeah, mom chewing her lips. She doesn't agree with dad. There's an inconsistency there. You're right, Stephanie. Yes, Sherry, you'd want to know more about what the child's facial expression means. Yes. Want to know more about moms and dads laughing? Absolutely. Or excuse me, mom and dad's relationship. What is the health of their relationship? What is their attachment style and how is that subsequently coming up with the child? Yes, absolutely. Their commonalities. Observation of hostility between the child caregivers or the child givers, yes. Ooh, want to know about their cultural practices and beliefs. Mom seemed more concerned than dad, and I wonder why. Why isn't he concerned? Why did the child laugh after remorse? Oh, a few of you guys are curious about that. Absolutely. So this is where we are assessing the information based off of what we're seeing, and we would ask a question about it. So tell me a little bit more about this laughter. Here, the therapist said, "Oh, that seemed like a traditional answer from a movie, right? Downplaying it, sure, but maybe also assessing or saying that that's where the child got it from." But one asking the child, you know, maybe directly, tell me a little bit about this laugh that you did after this statement. It sounds like you were sad and remorseful, but the laugh was confusing. Tell me a little bit more about it. That's how you're assessing based off of what you see. If you don't have time to do that, you would make note of it. You know, ask the client questions, statement of remorse, inconsistency because of laughter. Absolutely. Yeah, absolutely, absolutely. So here what we may be wanting to assess for is parenting style. We want to assess for the health and the relationship of the family. We'd want to look more in detail around those family dynamics and the roles. Remember in our family systems classes and courses, we talk about the different roles that each individual plays. Could it be that this child is now getting to an age where he doesn't want to be in a particular role in the family anymore? So he's stealing to get attention, or he's doing these behaviors to get an attention. See, if we jump into, say, oppositional defiant disorder for this particular student, or a conduct disorder because of this perceived lack of remorse, we may be missing that this is actually a family system issue and not necessarily an individual client issue. That the family system itself has to make adjustments so that the child can make adjustments, and not necessarily that the child is just acting out because he is oppositional. So that's why we would use the broadband approach first. I see that we're getting short on time. I love these kind of presentations. We don't have as much time to cover case conceptualization, but I wanted to show you the slide again. So if we're assessing the client, you see the clinician didn't have a clipboard here, but we're assessing the client and the family. We're looking at the problem list. So we're looking at what patterns are showing up, because we would have more than 3 minutes with this client as this clip shows. We would want to see, where are some of the cognitive challenges? Are there distortions that are here? What are some of the behavioral challenges? The client is laughing after statements of remorse. What are some of the attachment challenges? Are the parents connected to each other? Are their attachment styles influencing their parental style? What am I feeling, the humanistic? What am I feeling in the sessions with them? And what are they feeling in the sessions with me? So we will write all of that down. We will be gathering this information over a couple sessions. Formal case conceptualizations happen generally after between sessions 2 and sessions 2, 3, and 4. At the least should be where we're gathering this assessment information. And we're doing it based off of these primary theoretical orientations and looking at patterns. We'd also want to assess and see what are some of the triggers that the parents have as a unit, the triggers that mom has, the triggers dad has. Remember, mom was biting her lip, probably trying to hold back. The triggers that the child has. Maybe where did these problems occur? And positively, we're looking at what are the strengths of the family? What are the protective factors that are here? And what are those coping mechanisms as well? So let me see if there's any questions, because I want to make sure I'm answering all questions in this last minute. Okay. Martha, I use different suicidal assessments based off of the child's age, based off of the family dynamic, and based off of additional environmental factors. Why don't you send me an email separately and jot down some of the factors that are common in the clients that you're working with, and then I could tell you the suicide assessments that I'm likely to use. Because I take a lot of different factors in place when I'm thinking about the assessments that are used. All right, next steps. Well, this is the second part of the series. This is it. So I want you to go forward and assess with confidence, assess with compassion, and assess with curiosity. You see those 3 C's? Assess with confidence, compassion, and curiosity. And I 100% believe that you can and will do that. Here are some additional resources. Again, Kara and the team will ensure that you guys get these slides. So you can click right on the link and go to some of those assessments as well. And we have some upcoming CTAC events that Kara will talk about, and then end with my contact information so you guys can email me as you need to reach out to me. Be sure to follow us on IG as well, because that's where we give a lot of great tips as well. So thank you for having me here and participating with me last week and this week, and engaging with my extroverted personality through that chat. So thank you so much. And Kara, it's all on you.
Thank you. Thank you, Dr. Plummer. You're amazing. We so appreciate having you. I just want to review, we know it's time to close up, but just these 2 events coming up. We have a lot more, but we just want to highlight these: creating inclusive environments and peer roles, happening on Wednesday, June 9th. And then we have racial trauma within the AAPI community and communities, Thursday, June 10th, a really important webinar. I hope you can participate in both of those. Dr. Plummer's information is on the next slide. And just thank you so much for being with us and for all of your participation. These slides will be on our website later this week, probably by the end of the day tomorrow. I recognize tomorrow's Friday, probably tomorrow. So if not by Monday. Thank you all. And thank you again, Dr. Plummer. Looking forward to working with you in the future.
Absolutely. Thank you all. Thank you. Thank you so much. Thank you.
Take care. Bye, everyone. Have a great day.